LA County has one of the strictest mask mandates in the country, but things are about to change. We bring you the latest from the county's public health director.
I'm live here in the USC Village where you will see business managers and customers talk about the end of the LA mask mandate.
We talked to a USC alum who had COVID for 8 months. Her battle with long COVID straight ahead.
Starting tomorrow, LA County residents no longer need to wear masks indoors, a move that'll put the county in alignment with the rest of California. Good evening, I'm Vincent Demonte.
And I'm Olivia Tyler. The CDC's revised guidelines are based on the number of hospital admissions, hospital beds occupied, and overall rate of new COVID cases. The afternoon, this county's public health director announced changes.
In most public settings, indoor masking requirements will be replaced by a strong recommendation for all individuals, regardless of vaccination status, to wear masks when in indoor public places. Masking will continue to be required indoors at TK through grade 12 schools as required by the state until March 12th.
Today, the CDC moved the county out of the high virus activity category and into the low category. LA County hospitals had a total of 852 COVID patients today. That's down from 907 yesterday. Mask mandates will still be required in high-risk settings, such as healthcare facilities, airports and public transit, correctional facilities, homeless shelters, long-term care facilities, and K-12 school campuses.
So, how are local businesses reacting to the latest changes in the mask mandate? Let's take it live to the Village and hear from our reporter, Allie Anthony.
After nearly 2 years of strict masking mandates, Los Angeles is now allowing businesses and their customers to go mask-free indoors. The county's new health officer order says businesses and venues must verify the vaccination status of customers and employees before letting them unmask. Business managers here at the USC Village spoke with me about why loosening masking policies hasn't affected their businesses very much.
I don't think it really changes much from the past couple days after the mandate was lifted. We do still see about 90% of people wearing masks. All of our employees are still wearing masks just for their safety and protocol. It's just a little different in the sense of not telling people, hey, like put a mask on.
People have their concerns. Of course, for us, it doesn't really change. I mean, we don't wear masks, but everyone has the vaccine policy.
Like these business managers, customers also have opinions on how they feel about the mandate being lifted. Some customers are ready to say goodbye to masks, while others are not sure what to expect from a life without them.
It's just become kind of like a daily part of my schedule to, just put on a mask and then go to class or go to any store.
It's going to be weird to not have that little shield going on. I don't know.
I think it's definitely just going to be interesting too to see what it's like going back, because now we have a new normal, so going away from that is going to be really an interesting shift to see how people react to that. But I think it's time.
I'm excited to be able to interact with people and get to see their facial expressions and I don't know, I'm excited.
I'm of the opinion that masks, it was necessary for a long time, but it shouldn't be a normal thing.
Well, I've been in the Village all day long, and business is bustling as usual. What I have noticed is that many students and customers have kept their mask on indoors despite LA's new changes. With Annenberg Media, I'm Allie Anthony. Let's take it back to you in the studio.
Thanks, Allie. With COVID cases on the decline, USC has enacted several key changes to campus COVID policies.
There's no more routine surveillance testing for people who are fully vaccinated, up to date with their booster, and asymptomatic and not exposed. Yeah, so really had to do with cases being really low. Cases are below 1%. They're close to 0.5% right now. They've been precipitously dropping. So we felt like the time was right to drop the surveillance testing. We're still keeping Trojan check for the time being, but we are also actively evaluating that. And we hope to have something out on Friday or early next week to specify what the timeline is going to look like at USC.
Fully vaccinated students will no longer be required to test weekly. Guests will be allowed in student dorms and gyms and will no longer require a reservation. Students had mixed reactions about the new rules.
the pandemic still isn't over, and like we're still experiencing cases here.
I think at this point in the semester, it's kind of like makes sense.
I do kind of feel like it would be a better decision to continue like the weekly testing.
In smaller classrooms, I don't really freak out, but I guess in like my bigger lectures, I'm kind of like, I don't know if I want to be without a mask.
I know it's like a pain, but I feel like it's definitely worth it just to make sure you're not spreading anything.
USC will continue to monitor COVID cases on campus, but university officials expect the indoor mask mandate to be gone by the time students return from spring break.
And with life beginning to return to normal, students here at USC are reflecting on the toll the pandemic restrictions took on their mental well-being.
I wouldn't necessarily say that I felt helpless. The gym reservations are lifted, so we are already seeing progression.
Personally, I started doing therapy here at USC. Pre-pandemic, post-pandemic, I feel like I am a different person now, and that kind of actually helped me grow and just battling my anxiety.
No assignment is worth, tearing yourself up.
People are a lot more open about reaching out for help, having an expectation that professors and teachers and even employers pay heed to mental health.
Experts say the end of restrictions will have positive benefits for people's mental health, but not all the damage done by the pandemic will be fixed overnight.
Limited availability of qualified and trained mental health professionals has made it even more difficult to seek the kinds of services and support that one needs. Many of those who did experience symptoms of depression or anxiety during the height of the pandemic will find those symptoms beginning to diminish in severity and frequency.
According to mental health service provider, the MGH Clay Center, nearly 3/4 of college students experience a mental health crisis at some point during their college careers. 2 years after the pandemic shut down our way of living, schools are getting a chance to unmask. But as Annenberg Media's Mariah Hill tells us, things won't go back to normal just yet.
Wearing masks will no longer be required in California schools and child care facilities after March 11th. However, public health officials still highly recommend it. Regardless of their vaccination status, all students and staff can choose whether to wear one or not.
Make sure the ventilation in classrooms is safe, looking at ventilation systems, making sure that schools are teaching and reminding children to wash their hands, though to really go back to the basics about science, what germs are, how we transmit germs, how we can prevent disease.
Some parents say that this policy was long overdue, while others are concerned about their child's safety.
And a child does catch, brings it to school. They do catch it and they bring it to school. And the other kids may not necessarily catch it, but, it'll be easier for it to be passed around in the classroom.
Experts advise parents and teachers to encourage kids to wash their hands regularly and to stay at home if they're feeling sick. For Annenberg Media, I'm Mariah Hill.
As COVID cases continue to decrease across the country, President Biden offered a new perspective on the pandemic during his State of the Union speech Tuesday.
We've reached a new moment in the fight against COVID-19, where severe cases are down to a level not seen since July of last year. Just a few days ago, the Center for Disease Control and Prevention issued a new mask guidelines. Under the new guidelines, most Americans and most of the country can now go mask-free. And thanks to the progress we've made in the past year, COVID-19 no longer need control our lives.
Biden also announced that Americans will soon be able to order more free COVID tests from the government. Starting next week, all U.S. households can order an additional set of 4 COVID tests at covidtest.gov. If you need help ordering at-home tests, call 1-800-232-0233. According to White House officials, more than 50 million households have received their first free home COVID test, with another 10 million still waiting.
The LA Department of Water and Power says it's issued $275 million in pandemic debt relief to its customers. According to the LA Department of Water and Power, it is $827 million in debt as a result of the pandemic. Customers are now urged to take advantage of the relief program before a moratorium on utilities shuts off expires at the end of the month. Relief options include automatic credits, financial assistance, discounts, and extended payment plans. People looking for help with their utility payments can visit ladwp./financial assistance for more information.
If 14 days of COVID isn't bad enough, the CDC has found the virus can last up to 4 or more weeks. This is called long COVID. Annenberg alum Morgan Stevens experienced the health complications firsthand.
I started developing long COVID symptoms about a month after I tested positive for COVID. So I initially had that kind of week of feeling better, thinking I had recovered. And then I started to develop new symptoms that I hadn't had before my acute infection, like the insomnia and the tremors. I also had a lot of new symptoms that presented neurological symptoms like brain fog, sensitivity to light and sound, constant vertigo.
Stevens went to the ER 3 times, and each visit, doctors could not tell her what was wrong or treat how she was feeling. She described long COVID as traumatic. She had just graduated and was starting work at her dream job, CNN. Stevens is currently writing a book about the experience. Stevens is not alone. Senator Tim Kaine of Virginia is still dealing with COVID symptoms nearly 2 years after being infected. Yesterday, he joined senators from Massachusetts and Illinois introducing a bill to fund research and resources for those experiencing long COVID.
So Olivia, how are you feeling about LA finally lifting their mask mandate?
You know, Vincent, I am so excited. I can't wait to come home from spring break and take off my mask at school. It's been such a long time coming.
It definitely has. I'm really excited to finally be able to eat indoors across LA and not have to wear that mask. It's really exciting.
I completely agree. Thanks for watching See It Live. From everyone at Annenberg Media, I'm Olivia Tyler.
And I'm Vincent Demonte. Be sure to subscribe to our YouTube channel at youtube.com/Annenberg Media. Good night.